Well, a very warm welcome to the International SS COVID-19 update. What we hope to do in this session is give you a bit of a view of some of the outbreaks and lockdowns we've seen that have been springing up on a global basis. And I think we've got about 6 of them so far. We will also talk about the new cycle that we're seeing rather than the sort of linear waves that we've been looking at from a COVID-19 infection point of view. And then we'll come back at the end and look at some recommendations towards the return to operations, to office, and how that is being planned. Firstly, though, I'd like to go and introduce our panel of experts for today. I'm very pleased to be joined by a global group. Firstly, Dr. Isaac Akanko, who's dialing in from Ghana, Amy Simpson, who's joining us from Sydney today, and James Smallwood, who's dialed in from Singapore. So very welcome to the experts. Before we go into the discussion around COVID-19, let me just pass over to Dr. Isaac, who will take us through some of the background week's high events relative to COVID-19. Dr. Isaac, over to you.
Thank you very much, Mike. Good day to everyone. We continue to see a daily increase in cases of COVID-19 across countries and cities across the globe. We've currently seen highest daily increase cases to date. Current global count stands a little bit below 13 million confirmed cases, with over 500,000 deaths around the world. We still have the United States leading with total number of case counts, followed by Brazil in Latin America. And we've recently seen India surpassing Russia, taking 3rd place with regards to an increased number of case counts. This pandemic, it's interestingly not like what we've seen in influenza and SARS pandemic. I tend to describe it as a slow burning fire. We've seen countries and cities that we thought had done marvelously well and contained the COVID-19 virus, and also case counts had reduced. We're beginning to see resurgence and numbers in Australia, Melbourne area, in Tokyo, and in some states in the US, which is accounting for some lockdowns as we see in some parts of Australia, Melbourne area to be specific, Tokyo as well. Social restrictions that were relaxed are being reinforced. So we're beginning to see some cities also picking up on a second wave. New scientific evidence that is being presented with regards to a mode of transmission, where scientists are beginning to present new evidence that seem to suggest that the SARS-CoV-2, which is a virus that causes COVID-19, can be transmitted through aerosol. What they're suggesting is that small particles of the virus can stay longer or linger in the air for much longer periods of time and then infect anyone that is close by, especially in poorly ventilated enclosed spaces. Something that you're looking at, if it is really true, then the more reason why we need to wear face masks at all times if you cannot achieve the social distance of 2 meters. So these are some of the new updates that we've had over the last weeks. Mike, I'll hand over to you.
Very clear. Thank you, Dr. Isaac. Let's go down to Australia now and have a chat with Amy if we can. We've clearly seen and had discussed this issue about the lockdowns in Melbourne. We're potentially looking at some outbreaks in Sydney starting now that may lead to lockdowns at some point in the future. But Amy, just from your point of view, what does this cycle look like now? Dr. Isaac talks about the slow burning fire. It may be more of a peat fire, that it completely disappears at time and then reemerges. So can you tell us a bit more about the cycle, and also then what are the challenges companies are facing now with these new kind of localized lockdowns?
Yeah, sure. Thanks, Mike. Thanks, Dr. Isaac. So yeah, we've created this new visualization for the outbreak, and we've called it the COVID-19 cycle. And I'll take a moment just to explain that, because that's going to help me in explaining what we're seeing in Melbourne and other parts of the world. So this cycle actually more accurately portrays the pandemic as a continuum rather than that traditional wave with a peak that then tapers off and, you know, disappears. So, of course, it's a generalisation, and not all countries are necessarily going to pass through all of the stages of the cycle, but it just gives a representation that it's an ongoing issue around the world. So all countries are going to start with having imported cases in the first instance, and if transmission then gets out to spread in the communities, we might see the number of daily cases increase, and that's going to move the country through increasing activity and potentially into the outbreak category. But once public health measures are able to flatten that curve and we start seeing declining numbers, declining trends that are sustained, that country is going to move into decreasing activity. And hopefully if they can manage to get on top and control the outbreak, that's going to bring the cases back down to minimal numbers and back into limited activity. But this is a cycle, a slow burning cycle. So, you know, despite large outbreaks that are happening around the world, the majority of the population is still at risk. The studies that are showing that the percentage of the population who test positive for antibodies for the SARS-CoV-2 virus is low, even in those areas with large outbreaks. We're talking maybe only 5 to 10% of the population who are potentially immune. So in the absence of a vaccine, public health measures are all we currently have to rely on. And, you know, that relies on people following them and governments making decisions of public health cost versus economic or societal costs. So in these places where restrictions may have eased too quickly, or they haven't been used in combination with adequate public health measures, we're going to start seeing clusters and outbreaks happening again around the world. And for this reason, countries that may have been past that first peak or first wave, we might see them move swiftly back into increasing activity and to outbreak if community transmission happens again. So back to Melbourne, and Australia was, you know, quite comfortably sitting in the limited activity category throughout June, and most of our restrictions started relaxing, but the majority of our cases were being identified in people who had returned to Australia and then were undergoing mandatory quarantine for 14 days in a hotel. But we've seen in Melbourne that there have been some reported breaches of social distancing in these quarantine hotels, and cases have actually gotten out then into the community and into Melbourne, where several clusters have been identified. From that, we've witnessed quite a huge surge of cases in the last fortnight, and that's led to, at first, to hard lockdowns of apartment buildings where there were large numbers of cases, and that's now been expanded out to a 6-week lockdown for the Greater Melbourne area. And as Dr. Isaacs and you've said, Mike, you know, these types of surges and reinstated lockdowns are happening in more locations around the world now. We've seen it in Leicester, Beijing, Kazakhstan, Bangalore City in southern India. And we are going to continue to see those locations having lockdowns again as countries move through this COVID-19 cycle. But what I'd say are some of the challenges for the businesses operating in these locations. That would include countries needing to abide by changing public health regulations and what the authorities are stipulating. So the stay-at-home measures, or maintaining social distance, or the use of PPE, personal protective equipment, and masks. Businesses are going to have to look out for the mental health concerns of their staff, especially those facing another lockdown period. So managing stress levels or anxiety levels, how do you maintain productivity and also a work-life balance? And I think another challenge would be ensuring that the health promotion messages are up to date with the new evidence, the things that we're learning about the disease as time goes on. As Dr. Isaac said, this new evidence of aerosol transmission, that might change the regulations and the actions that we need to take. Thanks.
Thank you, Amy. That's great. Let's pop up to Singapore and have a look at the security perspective around this. And James, from your point of view, you're obviously working with a lot of clients up in across Asia. How have you been engaged in that, and what are you seeing as extended security implications over the next month or so?
The impact of the restrictions on organizations, the pending second waves, or as Amy says, the continuations of the cycle, are in many instances, from our observations, quite variable. So most, if not all, organizations are being forced to operate within a highly uncertain environment. particularly, we see areas become more or less permissive depending on case surges or outbreaks. As we see an easing of domestic and even international restrictions, organizations are balancing their need to travel with a clear requirement to safeguard their workforce and indeed their operations, whilst continuing to minimize their exposure as best they can. So this complexity is multiplied when you consider the sheer magnitude of information that is needed to understand what's occurring in the region and beyond, and also the speed with which things can change. So primarily, organizations at this point are faced with more questions than answers with regard to how to safely return to operations and indeed safely return to travel. And with regard to security implications, we continue to see different issues ebb and flow depending on the impact of COVID. So for example, in Indonesia at present, we've seen some potentially xenophobic-based protests as foreign workers arrive and return to sites. As a result of the economic impact of factory closures in South Asia, we see substantial unrest and clashes with police over wage disputes. And in some areas where we see security forces potentially overstretched, we then see a resultant increase in insurgent activity, like in Myanmar. And so the longer that the myriad issues surrounding COVID persist, the more volatility that we'll likely see in these and many other domains, and the more questions that businesses will have about their ability to operate within this ever-changing risk environment. Thanks, Mike.
Let's go to Africa and Dr. Isaac then, in terms of the final view of where we are from the challenges to clients. And Dr. Isaac, I mean, obviously we've got a rapidly changing environment across Africa. How do you see the main challenges being to clients, and how are they planning for return to operations and return to office?
There's no doubt that Africa is beginning to see an increase in number of cases, as most governments are trying to increase their testing capacities. I mean, it's just a basic principle that the more you test, the more your numbers increase, or you get to know your true numbers. It's quite a challenge with regards to if you look at the overall testing per population in Africa, just basically about 1% of the entire population. Having said that, with regards to return to work, there are a number of challenges that stream from public health regulations from different countries, as well as travel restrictions. So countries that have or accept in private charters to bring in expertise and expats back to various countries to continue with work have implemented the 14-day quarantine together with testing. So you're coming into country, it's 2 weeks that you've completely are in full government mandatory quarantine facility. And then you need to undergo a number of PCR tests before you can go get to your organization or get to site to work. Tends to also increase costs on to the client. In-country travels currently happening. Some other countries are still restricted, so it makes in-country movement quite a challenge in certain areas. If you come down to organizational setups and some of the clients that we support, we look at what programs and policies that they've put in place to create an enabling, safe working environment to be able to have their employees return back to work. Currently, most of them are working from home. Those who can work from home, there are certain organizations and certain companies that need to have people on the field, i.e. the mining companies, the oil and gas that still need to maintain operations and produce these minerals. So you look at them wanting to have a possibility of creating or ensuring that the employees that come to sites are safe, and they want to do that through testing. Now, there are some of the countries that PCR is the only approved testing method. Rapid test is still not approved in a lot of the countries in Africa. And the availability of PCR testing is quite a challenge. Even if you get to test, the turnaround time of the results is anything between 5 days to 10 days. So you lose quite a chunk of time waiting for results. And if you're not displaying enough to self-isolate and you are out and about, you end up exposing others. So it is also a challenge, and it's key that testing capacity is built up, and then there's a good return on test results so that a quick decision can be made. And if there's the need for contact tracing and immediate isolation, that can also be implemented. So these are some of the concerns and some of the challenges as we see in our clients with regards to return to workplace, and also having a hold-up area for an employee when they deem to be feeling unwell or they are a suspected case, and then calling on the public health authorities to support with regards to movement and testing. But amidst all this, we still have and see clients that still very much determined to maintain operations, and they are taking it on themselves with our support, where we provide consultancy as to how best they can shape and drive protocols that would create a safe, enabling environment. So these are some of the challenges we're facing with regards to return to work that we see with most of our organizations and clients that we support. But we're hoping that as testing becomes more available and you're able to make timely decisions, then it becomes easy. Also, companies are recognizing that they need to have return to workplace policies in place, which would outline in a very structured manner what you need to do to create an enabling, safe environment. And then if you have a suspected case, what you need to escalate and how to manage it, and to bring confidence to the employees who would be coming back to work.
Thanks very much, Dr. Isaac, for that overview and some of those recommendations. Let's move on to where the critical messaging is then that organizations are looking for, and how we're guiding those organizations relative to a safe return to operations. Amy, if I can come back to you, and just with a view to the lockdowns that you've obviously been experiencing down in Australia, how are you guiding clients in this uncertain time with developing a resilience agenda around their organization?
Yeah, thanks, Mike. So I think first and foremost, businesses need to ensure that they're following the guidance of the health authorities. You know, there are rules about when businesses can resume, social distancing in the workplace, the maximum number of staff that might be in an area, what records they're going to need to retain for contact tracing purposes, and, you know, encouraging staff to work remotely if that's the guidance. I think secondly, businesses need to be prepared for a variety of scenarios at this stage, because we can see that the situation can change rapidly. So, you know, be prepared for a potential case in your workplace or for further restrictions. I think in terms of advising businesses on their return to operations procedures, like, we've got to live with this new normal environment where COVID-19 is a risk, an ongoing risk to us. And the return to operations preparations, we can break those down into 4 categories. So preparing your workplace to accept workers, preparing the facility to accept workers, preparing the staff to actually return to the facility, the day of reopening, and the ongoing activities that businesses need to do. And there are lots of examples within those. So, you know, preparing your facility would include things like a risk assessment of the areas, looking at your foot traffic patterns, enhanced cleaning routines, minimising high-touch areas, creating an isolation room, like Dr. Isaac said. Things that you can do to prepare your staff for return would include identifying who are the essential workers that should be coming back into the office, what visitors are you going to allow, can you do a staggered staff roster and return to work, having a look at reviewing all the policies that you've got in place, particularly around sick leave policy and what your advice is going to be to people if they have symptoms themselves or somebody else in their household has symptoms, and things like your pre-screening and your entry screening at your site. So for the day of opening, things for businesses to think about will include a thorough cleaning and disinfection. So considering the ventilation systems, if a facility hasn't been in operation for months, making sure that that's been flushed out. Installing posters around the workplace with educational materials and health promotion, and having a screening station set up for entry screening at the entrance to the building or facility. And I think some of the ongoing factors include, monitoring what health authorities are saying and what their directions are, having review meetings with the management teams, making sure you're getting feedback from the employees, and doing continual education and health promotion. So yeah, my key takeaways would be making sure you're in line with what public health authorities are stipulating, and also just being as prepared as they can be for a variety of scenarios.
Amy, thanks very much indeed. And let's now move on and have a little focus on some of the mobility issues that we're seeing from an organizational point of view. We clearly see air corridors opening up now in a number of locations. So James, how are you recommending to clients that they approach that safe travel with these mobility issues in mind?
Safe travel is the operative phrase here. I mean, in short, we are advising organizations that they need to be able to understand the operating environment now, but be able to proactively identify risks that may arise when they're traveling and when they're operating again. And they must be able to prepare and educate their employees for these risks, and as well as prepare them, be able to communicate and track their whereabouts if needed. Very importantly, as well as to be able to have a plan to respond to the situation when it changes, to respond to the crisis. So to wrap it all in a bundle, finally, I would say that realistically, organizations need to be flexible in incorporating all of these factors we are talking about. Restrictions will change. Movement corridors or flight corridors that were open will close, and risks will evolve, and plans will need to evolve with them. Approaching this with a flexible mindset, these issues with a flexible mindset, will allow companies to adapt and overcome the issues as and when they arise.
Thank you very much, James. And finally, going back to Dr. Isaac, from a medical standpoint, can you give us some key takeaways that organizations can consider regards the return to operations, and especially with their planning and procedures in mind? And what kind of model do you see as a return with this increased exposure?
The first thing is to do a workplace risk assessment. Know your organization, know your employees, know who you want to bring back to work, your essential staff. Is there a possibility of creating a kind of a rotational system, teams, whereby they can work in different days, so that your essential staff don't all of them are not available at workplace at the same time. You would also want to ensure that you very much align with your local public health regulations. This must be incorporated into your workplace, return to workplace policy. What are you putting in place for your staff in terms of commuting, to ensure that once they leave from home, because that is part of your duty of care, to get to the workplace, they do that in a very safe manner, providing a bit of PPEs and in terms of face masks, hand sanitizers for them to use during these periods. And again, it's usually not only your employees that you're focusing on. You need to look at what your contractors, if you have contractors on site as well, make a room for visitors that might might need to come over to your organization. If any business can be handled without them necessarily coming to the office premises, that'll be first price. If it is impossible, then you need to create a protocol. If they are visiting a site, then maybe a health declaration form or something of that sort, to ensure that the person coming already is in kind of healthy in parenthesis state. Now, you want to ensure that you have a very good structured screening system prior to every individual going into work that day. So your capturing of data, temperature checks, and ensuring that these individuals' as data is well captured and recorded on a daily basis. This usually helps and makes contact tracing easy when you have a challenge. And I tell organizations that you can identify champions that would ensure that all these protocols that you've set in place is really being implemented. Aside that, HR also has a comprehensive role in terms of identifying people that are stressed, fatigued, in terms of mental health. Some organizations tend to oversee, but it is very crucial and provide the necessary support and access for them. Just to conclude, most organizations tend to want to put everything in the hands of one person to coordinate. I would encourage that it's a team effort. So you need to ensure that roles and responsibilities are well outlined, and people need to meet periodically to discuss and to review your plan. Your initial plan might be working well. You might have challenges, you might have issues. It's always good and it's worth revisiting what you've set up to ensure that you can fine tune to have a much more perfect system. Thank you, Mike.
Dr. Isaac, thanks very much indeed. And to all of you attending today's briefing, thanks for joining us. Enormous thanks to our team of experts from around the world. And should you wish to have any further information on the areas that the experts have discussed today, please do go to our website. The information is readily there, or reach out to your local International SOS contact. They'll be able to help you source the right information. On that, thanks very much for attending and wishing you a very good week ahead. Thank you. Bye-bye.